So in San Diego, it's kind of a new concept, a new technology that we brought along the way. And ever since we brought it along, there's been a lot of excitement around it, and a lot of people have been coming to us and asking us great questions, and we've had great results with the PDO threads. So threads, in America, there's a couple different forms of it. The ones we use here are called PDO, which is polydacinone. And the history behind that is dissolvable sutures. So for years, decades on decades, surgeons or even just doctors have been using dissolvable threads to sew up surgical procedures or sew up cuts and wounds, and they'll say, don't worry about it, it'll dissolve in a couple weeks. So that's where the technology came from. So with threads, what we can do is either we can lift tissue, we can manipulate tissue in regards to changing the volume, or we can just improve tissue quality. And what I mean by that is by using these dissolvable sutures or dissolvable threads, we can implant them in different places on the body, the face, the arm, the stomach, other places of the body, and we can lift tissue. So one of the things I ask patients or clients to do is the one finger test. When they come in, oftentimes what patients will do is they'll say, can you do this to me? So at home, you can take that one finger and lift and elevate areas. So either the face, either the neck, and that gives you a great representation of what threads can do. That is the lifting thread. So within three threads, or within the threads, you have three different types. You have barbs, which help elevate tissue. You have screws, which are little baby threads, anywhere from about 1 inch to 2.5 inches long. And what they do is they provide a scaffolding underneath the tissue. And then we have screws. What screws are they're coiled. So they look like smooth threads, but they're a little bit thicker and they're more coiled, and they add a little volume to areas of heaviness. So such as small line, the nasolabial fold, the marionette where it pinches over. We can put these thicker threads right into those areas and help volumize and create collagen in tissue. So the thread procedure itself, think of it as an ongoing procedure, just like anything else you do, whether it's Botox, whether it's fillers or any other aesthetic procedure. Think progressive. Come to us, have a sit down, have a conversation. We do a certain treatment. We'll typically ask you to come back in about 6 to 8 weeks, and then we evaluate. We take a look at the procedure, how well it's progressed, what improvement have we received, and then at that point, we have that same conversation. You can say, hey, Khanh, I've seen the improvement, but what else can we do from now? So just like anything else, think of it as a progressive procedure. Learn your face, learn your body, we can always add on. So with the lifting, that's what everyone wants. When you leave the initial procedure, you'll see that initial lifting, but that's not the end goal. The end goal happens month after month after month. So the way we do it is not just the lifting aspect, but how do we build collagen and how do we build good tissue? So as the months progress, all those areas that we put those smooths and those twists, and even the pulling threads, you start feeling and you start seeing that tissue slowly rise, and also the improvement of the tissue. So pores, wrinkles, texture, you'll be amazed when you come back in and you really see the promotion and the growth of the overall tissue area. So after that, we can talk about what are threads, what does it do, and then what it doesn't do. So one of the common fallacies that we have to encounter here is people read online, it's a don't go under the knife facelift. Never associated with the facelift. Surgery is a whole different realm by itself, and if you want to come in for that, we have beautiful plastic surgeons I can talk to you about that. But think of threads as an adjunct to everything that you can do in the medical spa area. You have Botox to help with wrinkles. You have fillers to help with volume, and then you have threads to help with lifting and improvement of texture. So think of it as tools in the toolbox. You wouldn't just use a screwdriver for absolutely everything. You wouldn't use Botox for absolutely everything. They all have their purposes. They all have the reasons on why we use them. And then if we use everything that we have in the toolbox, that's how we really get you to the goal the best that we can. So that's kind of threads in a nutshell. There's a lot more nuances to it, but it's a great adjunct procedure to everything that you do in the medical spa procedure. And then probably the last thing that I'm missing is how long does it last? So the threads itself last in the body about 4 to 6 months. Everyone degrades them a little bit different. So the threads itself will absorb and go away by hydrolysis, and then secondarily your body will break them down as well. But all that great collagen and all that great tissue that you built over those 4 to 6 months that the threads are in your body, that's what makes it really last. So the procedure itself can last anywhere from a year some of my long-term clients, I don't see them again for about 2 years. And even if I see them in the process of that time, I see that progression. And every time we take pictures, it just gets better, better, and better. So hopefully, Monique, did I explain that pretty well?
Yeah, actually you did. And that's really, I think, really helpful to understand that, you know, how they're a tool in the toolbox. It's not just one thing that they work on, but they work on something. Is there anything else that we have in that toolbox that does the same sort of lifting?
You can. So it depends on what the client's looking for. So some people will come in and tell me, Con, absolutely no Botox or absolutely no fillers. So depending on what your actual goals are and what your limitations are, we really build that game plan right around you. Now, in regards to lifting, can you lift with Botox? Sure, but that's affecting the muscle. So if I wanted to lift the eyebrow, or let's say fillers, you can lift the lower face, but there's a tipping point on how much you can do. So we'll fill the cheeks. And Lauren actually went into this greatly last week when she talked about fillers. But if we use fillers to try to lift the lower face, at some point, you can only give so much cheek with filler until the patient is saying, hey, that's enough cheek, I don't want to go anymore. Or say as a male client, males, you can't really fill the cheeks because it alters the shape of their face, and their face is completely different from a female. So how do I lift tissue from the lower face if I can't fill, or as a male, I can't fill this area? In regards to lasers, you can think of lasers such as alt therapy. And alt therapy acts on a different mechanism. What it does is it stimulates collagen. So yes, we're stimulating collagen with PDO threads, but at the same time, we're giving it a physical anchor with the threads themselves. With alt therapy, you can build collagen, but once again, that's a waiting game. So you have to wait month, and it will slowly progress to build that collagen, and your skin will tighten and slowly give the lift. So different methods for different people. We try to tailor it to you and really optimize your goal.
Okay, so I'm going to pull up my screen, and hopefully it'll work, everybody. Pray to the technology gods that it works. And Khanh can show you a few before and afters of some patients. Can you see my screen?
Yep, I can see it.
Okay, and let me just make it bigger. You can still see it?
Yep, I can still see it.
Okay, great. Okay, so here's a patient I'll let you talk about.
So pictures are really a great way to give a pictorial, because threads is a little hard to understand until you see it in person or we talk about the procedure in person. But I believe this one was a 32-year-old female who never had anything done other than some Botox. On the left-hand side, you'll see she's volume deficient. So what I mean by that is she doesn't have the volume to lift her lower face. So if you look around her cheeks, they're very flat, and you'll see a little groove running across her eye down to her cheek. If you look at her smile lines, you'll see heaviness around the corners of the mouth, and what you'll see is a jowl. So I believe for her main concern was actually the jowls. But when you treat the lower face, specifically for me, I like to treat from the top down, because what's causing the issue isn't just what you see in the jowls. It's all that heaviness at the top of the face that's dropping down. So could we use fillers? Sure. But for her, we wanted to really just take all that weight off the lower face and elevate it. So if you compare the left picture to the right, you'll see the jowls are almost completely eliminated. The grooves around her eyes have really minimized. And if you just look at the overall picture, she looks a little fresher, a little younger, and you can even see, and once Monique changes the pictures, you'll see the texture of her skin. So this one, same person, you can see really from the profile, her downturned lips are now upturned, her smile lines are almost gone, and the jowls, that jawline is just amazing. But if you look at her acne scarring right around her mid-cheek, what we did was we put little smooths in there to one subsized area, meaning we're unpuckering the tissue that's tethering the scarring down. And then two, with all that collagen promotion, I believe this was 5 months apart, you can see the improvement in her skin. So it's not just the lifting, but how do we improve the overall texture of the skin? You can see it's almost glowing now in that lower picture. So it's fantastic for things like acne scarring as well.
Wow, that's amazing. Okay, we're going to go to the next patient here.
So this lady, I believe, 68-year-old female, post 2 facelifts, I believe. So on the left side, you can see this lady has too much volume. So we can't really use fillers to elevate or reshape for the fear of making her too round and putting too much volume in her face. So this was the course of over 6 months. So I believe we did an initial thread treatment back in June of 2019. She came back to me in September of 2019, which we did a follow-up, which is very, very important. Remember, come back to us in 6 to 8 weeks so we can evaluate. But we can look from the top down again. You can see softening of the eyebrows, because we did an eyebrow lift on her as well. So now her forehead isn't working overtime to lift her eyebrows. So we soften the forehead just by not making it work overtime. And working from the top down, you can really see her cheeks. We've moved the weight from the front of her face to the back of her face where your weight and your cheeks should be. If you look at her lower face, it's just so much softer right there. We softened her lips, we softened her lines, and I mean, I couldn't even tell it was her when she came back into us 6 months later, but you can see just a dramatic change in her facial structure, the tone of the skin, the glow of the skin, and the reduction in the wrinkles as well.
And here's her 3/4 profile view.
Yep, so you can really see from the oblique as well, how soft she looks now, how elevated she looks, and just all the lines and creases, how much better she looks overall. And this is with threads, with Botox, and a little bit of filler to soften everything out. So this is a great example. It's not just threads, but it's a combo treatment to get her to her final result.
And could you explain like where you might have used the filler?
Yeah, so after we lifted, so great question again. So of course, Botox from the eyes up, Botox around her mouth too, to soften those pucker lines that she had, what we call smoker's lines. She doesn't smoke, but that's just a term that we use. But fillers, after we lifted everything, we use fillers right around, we call the nasolabial folds or the smile lines, and then with around the lower mouth. Because what happens when we age is we lose bone, we lose fat, and we lose collagen. So bone and fat are kind of our volume systems. So after we lifted all that weight off, how do we put volume back? And fillers is a great way to put that volume back that we've lost over time.
Okay, awesome. And then here's our next patient.
Yeah, so this is a good example of building tissue quality. So on the upper picture, you'll see around her cheeks, the lines extending from her eyes all the way down to her jawline. So essentially what happens when you lose collagen, you lose that hardiness and the thickness of your tissue. So every time you animate, every time you smile, it crumples like a thin piece of paper. So how do we thicken that piece of paper? So every time you animate, you're not crumpling your face. We call those parenthesis lines or barcodes. So you can see on the lower picture, I believe this is 4 months out, that because we're not ingraining those lines anymore, they've really softened. So you can probably see the remnants of that harsh line, but all the lines before and after that in regards to the wrinkles have really, really minimized. And now her jawline is starting to form as well because we're lifting and we're improving the tissue in that area.
And I think we have one more view of that.
And this is a great one right here. So this is on animation. So big, big smile. You can see in the upper picture how many lines she has when she smiles, because with that thinning of the skin and this thinning of the collagen, we just don't have that hardiness of the skin to support us anymore. You can see also with the jawline, when the skin is lax, she has no delineation between her face and the jawline and the neck. Whereas in the lower picture, big smile once again, but all those lines have truly, truly minimized, and now you can see that jawline coming in as well because we're giving it more structure.
Yeah, that's amazing. Okay, so here's our next patient.
Here's a good example of a 36-year-old female. On the left picture, don't mind that black eye. She had eye filler about 2 weeks before she came to see me. But you can see what happens with an early 30-year-old. She doesn't have much to correct, and she's already absolutely beautiful. But her main concern was actually her jawline and her upper neck. So once again, the focus for her was the jawline, upper neck, but the treatment itself is focused on the whole mid-face, the lower face, and the upper neck, because we're correcting everything that's causing it. We're not just treating the symptom, but we're focusing on the cause to give her the real treatment that she needs. And you can see on the right side, if you look at her lips, on the left side, she has a perpendicular lip, so very flat, parallel, sorry. On the right side, she has an upturned mouth now because we've relinquished the weight in that area and we've turned that mouth up. If you look at her eyes Her eyes are more supported now because we turned up the cheeks and supported her eyes. But on her lower face, what mainly concerned her, look how pointy her chin is now. Because in the left side, she doesn't have jowls per se, but she does have heaviness in the lower face. Now that we've lifted it, you can see how structured she is now. It's that heart shape, it's that upside down triangle that women strive to get.
And let me go to another view.
And this one is fantastic. You can really see it on this view right here. So she has a great jawline already, great lower face. But for her, it was just the mini changes, the minor adjustments. And this is only actually 1 month out. So 1 month out, she's already had this great production. And once again, really look at how smooth her skin looks and the glowing, radiant look that she gets. But after month after month after month, this jawline is just going to get tighter, tighter, and tighter. So great improvement even after just 1 month. And this one you can really see. So if you look at the front of her neck, you can see just a little bit of laxity right there. And the jawline, a little bit of laxity towards the back of the ear as well. And unfortunately, the hair is covering it. But if you look at the front of her chin, you can see that little bit of laxity that drops down is completely gone. She has a really sucked up neck at this point.
Wow. Okay, and then we can do things on the body. So here's one example to talk about.
Yeah, this is a great example of what we can do for the body. So the body is a little bit different from the face. So on the body, especially around the legs, the arms, the stomach, or even the chest and neck, we don't have structure to hold that area up. Whereas the face, we have bone, we have fat, and all these other things that we can replace with volume. But you can't just pump in volume into a leg and expect it to lift. So on the left side, very fit lady, I believe, 48 years old, very, very fit, runs a lot. And she's like, no matter what I do, I can't get rid of this because it's not muscle, it's not fitness. At this point, it's just collagen. How do we induce collagen to really tighten up this area? And this is immediately post-procedure. So if you can look on the right side, you'll see a couple of puncture marks on her legs, and that's essentially what you leave like. Just little puncture marks that will heal in about 24 hours. But what we did was we lifted the tissue from the upper knee, and then we also built a lattice of collagen around the knees itself. So if you can imagine this is immediately post, you can imagine what it will look like 6 months down the line. As that collagen builds, it's just going to get better, better, and better.
Wow. Okay, and here's a picture of you doing that same lady.
Yeah, so you can see she's pretty comfortable. I think she's actually taking pictures of the procedure in the background. But this is us implanting the barbs. And the barbs, sorry I didn't explain this in the beginning. Think of it as one of the provider calls them foxtails here. So what it does is we implant it from the top all the way down to where the tissue falls on the knee, and we lift the tissue. And instead of the tissue falling back down, what it does is it catches on those foxtails and holds that tissue up. So that's what we're doing right there, is implanting the barbs. So all we do is we just topically numb the area, and then we just do some local infiltration of lidocaine to numb the area further. You're fully awake the whole time, very, very comfortable. And the procedure takes, depending on the area, anywhere from about half hour to an hour.
Okay, and so I'm going to stop sharing my screen and go to some questions. I think we're back. Are we back? Okay, so we have one question. How many threads do you use per area, such as the jowls? And also, can they be used for the neck area? How many? How long? And approximately, how long do they last? And what's the cost? So it's like a four-in-one question. Sorry.
Hopefully I remember all that. So let's talk about how many threads it takes. When you think of threads, if you've ever done Botox, if you've ever done fillers, kind of think of it in that realm. Every person is going to be different depending on how heavy the area is, how much laxity you have, and what's your age. And when I mean age, I don't mean your chronological age, but your skin age. Because a 40-year-old can have one type of skin versus another 40-year-old. So we'll have a set treatment. We have a set amount of threads that we place into that area. We'll do that for almost most patients. After that, leave it alone. Go home, learn your body, let that collagen really build, come back to us in 6 to 8 weeks, and then we can add on at that point. But let's just take it on average. So for the jowls, this lower area where we're talking about, once again, don't treat what you see, treat what's causing it. And what's causing it is all this weight in the mid and lower face just dropping. So we have to take all that weight back. So typically, let's say it's anywhere from 3 to 4 barbs per side. So that's 8 pulling threads. Once again, that's not the foundation of the treatment. It's really that scaffolding that we build everywhere with the smooths and the twists or slash the screws. So probably a totality of anywhere from about 20 to 30 threads is what we're using, because we want to make sure we're not just giving you that instant result, but we're giving you that long-term result that everyone is seeking. So anywhere from about 20 to 30 threads, Monique, for the gels. Longevity. Longevity, multifactorial. How old are you? How much collagen did you build in that time? And how healthy are you? Are you a smoker? Are you a sunbather? Are you doing other things, topical treatments? Are you coming in to get facials with our esthetician? Are you keeping up with all your other procedures such as Botox and fillers? That plays a huge role in it. But on average, if we do the treatment appropriately, on average, if a person is healthy, expect anywhere from about a year to 2 years, on average about 18 months for the procedure. And don't think of it as a steep drop-off, just like fillers, well, mostly fillers. What happens is you build up to your goal. And instead of waiting for it to drop off, you come back in for your follow-ups, for your treatments. You can come back and say, hey, come on, I still see great results, but can we do a little bit more? And at that time, we just keep on progressing it and maintain that goal for you. So think 18 months. And
Okay.
then in regard, and I think, did you mention pricing too, Monique?
Yeah, they were asking, what's the cost?
With pricing, that's really up to our care coordinators. As providers, we try to remove ourselves from the pricing because we want to make sure we're completely honest with you. We're building that package based on your personal goal. At that point, we relay that message to the care coordinators. They're fantastic. They come in and they discuss all that pricing openly with you. So whatever you guys decide or discuss in regards to pricing, that's in private. We remove the providers completely from that. Then you can reach out to Charity, Diana, all of our other wonderful care coordinators, and even Monique will get you in touch with the appropriate people, and they'll discuss all that with you.
Yeah. And I think that's a really good point that you said about, you have your initial treatment, wait, 6 to 8 weeks, see how you are, come back in. But then, maybe let's say at a year, you come back in again and reevaluate, because maybe you're just going to add a couple more threads or do a filler instead, or how to kind of, I think we as patients sort of know what bothers us, but we don't know how to fix it. So I think people understanding, come back and talk, and let's take your pictures again and put them side by side and see, what we can do to sort of maintain the result that you got, rather than letting it sort of slip back to baseline. Okay, so another question we have, how long is the downtime?
So downtime is similar to a filler, because anytime we put needles into your body, give yourself about a 2-week buffer. Always anticipate bruising, always anticipate swelling. We hope it doesn't happen, but you can never control that. So I say give yourself a 2-week buffer in regards to special occasions such as a wedding, a photo shoot, first date, anything like that. Threads are a little bit of a different animal because you want to really protect those threads when we put them in. You don't want to damage them. You don't want to manipulate them. So my rules are, if we're doing the neck up, it's the 1 week rule. 1 week, sleep on your back, elevated. For 1 week, soft diet, meaning no steaks, no bubble gums, no big hamburger bites that might manipulate the threads. No hardcore working out. Walking is fine, but no jumping, jostling, jogging. You don't want to manipulate those threads. That's usually about it. For the body, it's a little bit different. In the body, if it's a very mobile area, I ask you not to exercise from anywhere from about 2 to 4 weeks to not manipulate those threads. And then once again, with threads, it's a little bit different because if we do fillers, if we do Botox, and we bruise you, we have a fantastic bruise laser where we can zap it, and it really eliminates that bruise pretty quickly. With threads, unfortunately, you can't do lasers within a month, because if you do any lasers, especially very, very hot lasers, such as the bruise laser, you can't zap that area because the fear is you might degrade the threads that we just implanted.
Oops, sorry, I was on mute and I had to take myself off mute, or you guys can't hear what I'm saying. Okay, the next question we have is, Kim asks, can we show before and after pictures of the entire neck that used threads? Was there one of those in what we had, or do we need to maybe post some pictures after?
If you go to Chrislyn, if you want to pull up one of her pictures, we can.
Okay, let me share again.
So with the neck,
Let me go to her. Can you see, am I on here?
Yeah.
Okay.
So her main concern was the jawline and the upper neck. So when you treat the neck, the upper third of the neck, you can treat with barbs, meaning the pulling thread. So we can really pull that tissue back and elevate the tissue. The lower 2/3 of the neck, that area is very, very thin, and the tissue is a little bit different, so we don't necessarily want to do pulling threads in that area. Ways we can help treat that area is to put in smooths, put in twists to help with the wrinkles, and build a scaffolding of collagen. So upper neck, absolutely, we can pull that all day long and lift that upper neck, and you can really see that difference. Lower neck, building of collagen is really the way to go about it. You can use threads, you can use lasers, you can use collagen induction injectables. Any way you can really build tissue, that's more for the lower 2/3 of the neck.
Okay, let me go back to stop sharing and come back to you. And we had a couple more questions. Any negative aspects to the procedure?
Yeah, so negative aspects, let's talk side effects. So side effects, they're very similar to what a filler would be. And what I mean by filler is like your Juvederm, Restylane, because instead of us implanting a filler, such as a HA filler, implanting a thread. So bruising and swelling, of course. You have nodules, which is very, very rare, especially with the PDOs, because the PDOs are absorbable and they're biodegradable, such as the same ones that you do with sutures. They're the exact same materials as a lot of the sutures that medical professionals use. The other ones are aesthetic dissatisfaction, meaning the procedure that we do, you do not like it. And then the last one is lumps and bumps. So lumps and bumps that you go to fillers is because of different aspects. You can dissolve fillers. But lumps and bumps that you get from threads, either one, you naturally get a lump and bump from it. Two, the thread was placed wrong. Or three, sometimes the person who, or the client who's receiving it was probably not the right client. Either their thin or their skin was too thin and they didn't take the thread very well. Or two, their skin was too heavy and it overpowered the thread and now you have a little buckling effect. So that's probably one, this is actually a great question in regards to choosing the right client. So for most clients, everyone qualifies for threads from a health standpoint, but not everyone qualifies for threads in regards to an aesthetic satisfaction, meaning is threads going to give you what you need? Are you a person that needs a facelift at this point? Then we'll have you consult with our plastic surgeons. Are you a person that your skin is too thin to support threads? And we can do other procedures to thicken up that skin, and then we'll promote to threads. So client choosing is very, very important in that. But in regards to side effects and aesthetic issues, think of it very similar to fillers.
Okay. Great answer. I think that's a really good point. And what about just kind of jumping onto that same idea, threads aren't going to give you the same lift as a facelift, but what if you're somebody who maybe had a facelift, like that one patient you saw, maybe you had a facelift 15 years ago. Are threads something that you could use after a procedure like that?
Absolutely. And we've done a lot of those actually. One of the examples that you put up, she was post 2 facelifts. I can't remember what her last facelift was, but at that point, I think her doctor told her that she didn't really qualify for a facelift anymore. I'm not really sure about that. But in regards to facelifts, absolutely, it's a great treatment afterwards because we can still support the areas. We can possibly reach areas that the facelift didn't reach for you. We can promote collagen production. We can promote improvement of the skin. Now, in regards to when you can do it, that's really up to you and your surgeon and your provider. From my standpoint, typically it's about 6 months and beyond, but because we have a surgery team here, anytime a person is post-facelift, I always run it by them. I said, hey, this person had a facelift with you, or this person had a facelift somewhere else X amount of time ago. Do you think it's appropriate for me to do PDO threads for her? And they'll give me the thumbs up or the thumbs down. So that's another benefit of coming here because we really have a group team effort that we can really bounce ideas off of. But in regards to the facelift, absolutely we can do it. But actually, Monique, great point in regards to facelifts is the scarring that it happens. So anyone who does your threads, they should be familiar with doing threads in a person who's post-facelift, because the procedure sometimes can be different because of the scar tissue that has formed after facelifts. So great question.
Excellent. One person said, I'm getting married in August. When should I plan to have the procedure done to allow enough time, to look good?
Kind of a two-parter. So one, I would say at least 1 month out, because with threads, if there's any issues, we want to make sure we're able to have enough time to address that issue for you. Now, from a perfect standpoint, I would say 4 to 6 months out. And why? Because of that. Whatever procedure we do, I want you to come back to me in 2 months. We reevaluate. We can put in some more threads or we're happy with it. But if you did it 6 months before your wedding, imagine all that collagen production that you produced all the way up to your wedding. So yes, you got that beautiful lifting, but in that whole amount of time, your skin is improving, your wrinkles are improving, your tone, your texture, all of that is improving as the months go by.
One person asked, is there bruising with thread lifts?
Potentially. So anytime needle to the body, you always have to anticipate bruising. You always have to anticipate swelling. But with the thread lift, you really don't get it that much because a lot of the threads we implant with are implanted with cannulas. And cannulas are blunt. So when I implant the cannula, most of the time that little introducer that I put in to implant the thread just pushes any veins and veins out of the way. So there's less risk of bruising, but always prepare yourself and always give yourself a 2-week buffer.
Okay. One person asked, I heard therapy is another good treatment for skin tightening and lifting. How do you determine which would be best?
So
and is that something you could combine?
Absolutely. Alt therapy is a fantastic procedure. So just like you asked me before, who's the right client? So once again, it's that sit down conversation. I never drive that conversation. It's you, Monique, coming into me and saying, hey, this is my issue. What are my alternatives or what are my options? So you can think of alt therapy as a completely non-invasive procedure. So with that one, we take a laser to promote collagen. And as the months go by, usually all the way up to about 12 months, your collagen is improving and building. So that's how you get the tightening and lifting with alt therapy. Now, if you're the type that told me I want more instant gratification, then we can give procedures such as threads where you get more instant gratification plus the building of collagen. Now, optimally, if this was the perfect procedure, the perfect client, the perfect time frame, I would say do alt therapy first, come back to me in a month. Then we do threads. While that alt therapy is building your collagen in the background all the way up to a year, you have this thread procedure that one, gave you more instant gratification, then that alt therapy will continue to stimulate collagen while those threads are stimulating collagen as well. So more soldiers to the fight, more tools in the toolbox to use.
Ooh, I love that. I'm like ready to jump over, jump through the screen. Who's with me? There's, let's see. Well, let's see. I'm looking through these questions. Men. Somebody said, do men need more threads than a woman, or is it about the same?
Once again, it's more dependent on the person, depending on the skin age, depending on how many areas we're treating, what is the actual cause, how much laxity. So I don't think there's a big difference between men and women. I think men have less options in regards to how we treat certain areas versus women. Just like I think we mentioned earlier that to lift, if we use fillers, we can fill certain areas of the face to lift the face. For a woman, because they have more volume in certain areas, such as the cheeks, they can support more fillers to lift tissue. Whereas a man, you put too much volume into a man, you can really feminize them. Or if you put too much volume in the wrong places, you can really make them round or put too much weight in their face. So for men, we don't have as many options, so threads is a great option in regards to lifting and tightening that area.
One person Lisa asked, can it be done on the back of the hands?
Absolutely. So back of the hands, one of my providers made a good point. A lot of us focus on what we see for the neck and the face, but the other things that people see from us often are our hands. we talk with our hands, we animate with our hands, and our hands are always exposed. So with the hands, once again, it's collagen loss and volume loss from the fat. So we can put back volume with fillers, but how do we promote collagen growth to thicken that tissue, to thicken that crepiness that we see in the hands too? And we can take little threads, those little baby smooths, and lay a lattice into the areas of the hands and build collagen and build that thick, hardy tissue and bring it back to those baby soft hands that we always strive for.
And what would be, as somebody who's on the computer like all day, every day, would there be any things you don't want people doing with their hands after?
Nothing strenuous. So no weightlifting, no excessive hand movements. On the palms, the dorsal aspect of our hands at the top, we don't really move that. We're not treating the fingers, so it's not really that big of a deal. But within the week, you want to be gentle with them and no strenuous activity, because the little smooth threads that don't anchor onto anything, we're just implanting them to build quality of skin and quality of collagen. So they can migrate out, not a big deal. I tell people, if you see a little cat whisker poking out, grab a pair of tweezers, just pull it out. It comes out like a little piece of dental floss. Just save it. At the follow-up treatment, we'll put another one back in. But you just want to protect it to make sure that they don't migrate or they don't come out.
Okay. And then can threads help with loose skin in the abdomen area?
Yeah, absolutely. So in the abdomen area, post-pregnancy, or just with the aging process and you lose collagen in that area, it's not always due to fat that causes the weight, but that upper layer of skin that starts to fold over or starts to fall south, what we can do is, once again, either one, we can lift the tissue in that area. So one finger rule again, take that one finger. If you can lift the tissue from that area, most likely we can assist it with threads. The second part of that is putting in those smooths. You'll hear me reiterate that over and over. It's not just the pulling threads, because that's what you see initially. But if we don't build that collagen mesh for you, that collagen lattice, that's why procedures don't last. And that's the big difference in how we do our threads versus other facilities. They'll give you that instant gratification, but they won't give you that longevity of the year, 18 months, 2 years. So it's really about that collagen promotion that we're striving to achieve.
So what would somebody, I guess if somebody was shopping for threads and they were asking the potential provider, like what would be the questions you would say that you should ask as a consumer to get the best result? Like other than coming straight to you and LGCSC, but really kind of what's the homework they should do?
I think Lauren really hit this on the head last week. So if you want to tune back to the old quarantine with Lauren, she had great info on how to choose the right provider. But some of the key things that she hit on was really build that rapport. Are you comfortable with the office? Are you comfortable stepping foot in there? Are you comfortable with the front desk? Because you see all those things before you even set foot to see the provider. And at that point, are they driving the consultation, or are they listening to you and really hearing what you're saying, your time frame, your budget, your goals? Are you opposed to a procedure? Are you for a procedure? So it's really listening and understanding what you're wanting to do. And at that point, do they explain the procedure to you? Do they draw on your face? Do they manipulate your face? Are they showing you the end goal? And then are they over-promising? Are they saying, look, one and done, you're out of here. I won't see you again for years on end. You look fantastic. Don't even go to the plastic surgeon because you don't need it. Save tons of money and be here. Those are the key words you want to listen to. It's that over-promising. It's that comfort level. And then after that, are they following up with you? After that consult, did that provider send you an email breaking it down for you? Hey, these are the suggestions we made. The care coordinator emailing you saying, hey, this is the price quote that we're giving you. How can we assist you? What other questions can we do? If you want to come back and have a follow-up consult, feel free to come back and talk with us. It's really about making you comfortable with the procedure and having that full understanding, so you've armed yourself with all this education. So when you have that procedure done, you're not like, should I have done this? Why didn't I ask this question? Why didn't my provider tell me this? It's really having that full consultation from the moment you step into the door to the moment you step out.
That's so good. That's great information. And I think today's been such a really valuable session, because there was threads 10 years ago, but that was a whole different you know, kind of procedure than the new threads that we're talking about. And so, you know, there's a lot of, it's sort of, even though threads have been around a while, not in their current form. And I think, so in that case, it is such a new procedure that not everybody knows, you know, that all the different places you can treat and kind of how they work. And so I think this has been really informative. Two things. So I'm going to share my screen one more time. And let's go there, share, and play. So it's a full screen. So thanks for attending. A couple things I wanted to tell you about. So we've got a couple more sessions this week. You can go to ljcsc.com/events and see everything else that's coming up. If you want to have a virtual consultation with Khanh about threads or any other procedures that we do, be sure to call or text us. Charity is manning the phones and the text line, so she can help you set that up. Or you can email us, of course. And if you want to be on our text message list, you can text GLAM to that number right there, 858-452-2066. And then one other thing to let you know, and it's over on our website, on our specials page, we do have a Glam Fam, which is our VIP discount program, if you will. So we right now have a special where you buy a year, you'll get a year free. So that's 24 months of Glam Fam membership pricing. So you get special pricing on everything you do with us in our med spa, including even products. So that really helps to be able to say, okay, as my budget, you know, and we do offer financing and other things as well, but just to really say, okay, I'm going to get, you know, very special pricing and access to specials that I wouldn't normally get. And that really helps to make your budget stretch further. And I think all of us, I know I'm all about, you know, if there's a discount, I'll take it. So, so that Glam Fam 2-for-1, we've never done that before. And I think if you're a current member, you can add on to your current membership. So say you have 8 months left, we're already going to give you a couple extra months since you can't use it right now during while we're closed. So we're already going to give current Glam Fam members a few extra months on their membership. We're already doing that automatically. And then you could re-up or, you know, renew your membership by buying 1 year and getting another year free. And so it just gives you those perks for longer. And you can get that online or you can call us, but our store is shop, shop.ljcsc.com, and you can buy it right there or go onto our specials page on the website. So thanks all for attending. We love having you come to these sessions, and we really appreciate you taking the time to spend a little bit of your day with us. And we will see you guys at the next one, I hope. And thank you, Khanh, again. It was a wonderful session, and we'll say goodbye for now. Thanks. Bye-bye.
Everyone.